Okay, so hello guys, I'm back. Good evening. So here is my continuation on chapter 5, Daigosho. So yesterday night we talked about Seikatsu Shukan Bio, so lifestyle related diseases, and lifestyle related diseases that affects the elderly. So first we finished high blood pressure, and that was Koketsu Atsusho, and we were at the second topic, cancer or gan, when I stopped yesterday night. So we'll continue starting from gan. So gan is an akusei shin seibutsu. It's a malignant tumor, and the top three types of cancer is different from the male and the female. So for the male, for the dansei, so we'll separate them. So the dansei, the number one most prevalent type of cancer is the cancer of the lungs. Then the second one, the second most prevalent type of cancer is the E, or the stomach. And then the last is the daicho, or the large intestine. So I wrote it down here. So first is hai, that's the lungs, E, or the stomach, and then daicho, large intestine. And for the josei, or the women, the first or the most prevalent type of cancer is daicho. So that was the number 3 for the male. So for a female, it's on number 1. So daicho, it's the large intestine. And then, so we have here daicho. So the next one, the second most prevalent among women, is the hai, or the lungs. And then the third one is the suizo, or pancreas. Am I right? This is the pancreas, right? Honto? I'm shocked. So for the male, what were those again? So we have the hai, the E, and the daicho. And for the females, we have daicho, the hai, and then the suizo. So in English, for the males, we have the lungs, the stomach, and then the large intestine. For the females, we have the large intestine, the lungs, and then the pancreas. after that, so aside from that, for male 70 years old and above, it's also one of the prevalent cancer is also Zenritsusengan, so the prostate cancer. And for the female, the Shikyugan or Nyugan, so breast cancer. Okay, so we're down to the number 3. So the number 3 is, what was that? Those again in English. Ischemic heart disease. I'll write the kanji here. So this is the third. Kyoketsu Seishikan, ischemic heart disease. So what did I write here? So we have, I wrote here Kyosaku and Heisaku. So Kyosaku, narrowing. So the there are two. Kyoshinsho. So probably it's MI, myocardial infarction, and angina pectoris. Because one is treated with nitroglycerin, right? Nitoroglycerin, sublingual, under the tongue, and the pain subsides. So I think that's angina pectoris, right? So we have two types. Kyoshinsho Nitoroglycerin. Toyo nitroglycerin. And then the second one, Kyusei Shinkin Kosoku. So I wrote it here. So the first type is kyoshinsho, and the pain gets relieved with nitroglycerin, zekatoyo, under the tongue. So shita no shita toyo. So zekatoyo, nitroglycerin. So it's actually not serious compared to this one. Kyusei Shinkin Kosoku. So Kyusei Shinkin Kosoku, myocardial infarction. So here the blood vessels, it's not really that totally blocked. There's still supply going to the heart. However, here there's a kosoku. So there's blockage and blood isn't going through properly to the heart muscles. So if the heart isn't receiving blood, then it dies, right? So it also causes shock, and it might lead to death. So this one is really serious, so because it happens CUNY. So it happens suddenly, like the no kosoku, right? Cerebrovascular infarction, the stroke in the head, the no kosoku, right? That also happens suddenly, CUNY. It's the same as this one. Heart attack. In layman's term, it's heart attack, right? So it's a serious matter, a serious disease. So that was about Gyoketsusei Shinshikana. So we're now on the number 4. The number 4, it's gonna be To-nyo-byo. So it's diabetes mellitus. In short, it's diabetes. To-nyo-byo. There is sugar in the blood. There's sugar in the urine. So that's actually one of the signs and symptoms of diabetes mellitus. There's sugar in the urine. So there are 2 types of to-nyo-byo. So first we have Ichigata. So we have type 1 and type 2 diabetes, right? In English. So type 1, Issei Ichigata. I think it's Ichigata. Ichigata Tonyo It's insulin dependent. Insulin is on say insulin dependent. So this is the type that carries along with them. I mean, for patients having this type, they carry with them insulin injections. They have an insulin syringe, yeah. So whenever their blood sugar elevates, they have their medicine with them, insulin, to lower the sugar level in the blood. So usually this is prevalent among the young ones, wakai shito. So the second type is the Niigata. Tonyo. So this is type 2, diabetes mellitus. Insulin heism. It's not dependent on insulin. Heism. So type 1, insulin dependent. What's the term for dependent? Isom. And type 2, it's not insulin dependent, so insulin heism, not dependent. So for this they have oral medicines, tablet, capsules, to control blood pressure, blood sugar level in the blood, not blood pressure. I'm so sorry. So the signs and symptoms of tonyo. So first we have Gettochi. Is high, is elevated. Gettochi is glucose, blood glucose level. It's high. And then we have Kokatsu, which is nodo ga kawaku koto. Thirsty, getting thirsty. Polydipsia. I don't know if the spelling is correct. Polydipsia. And then we also have Hinyo. So shout out to my father. His name is Hinyo. Again. So there. Hinyo. So frequent urination. Polyuria. There's also one though, polyphagia. This is getting hungry all the time, but it's not shown here. Hungry all the time. Is it me? Weird. So what were the 3 signs and symptoms again? So we have Ketouchi takakunaru, and then koukatsu, nodo ga kawaku koto, and then hinyo, or frequent urination. So it's called 3 P's, but polyuria, polyphagia, and polydipsia. And elevated sugar level. So one thing that should be you should monitor for, because this is life-threatening. This one is life-threatening. So we don't want this to happen. So even if you have high blood pressure, high blood glucose level, why do I keep saying high blood pressure? Well, we're done with that. High blood sugar level, you don't really die that instantly. It takes time. Death doesn't occur just because you have high blood sugar level, but because of the complications. So it really affects the kidneys, the heart, what else? Other parts of the body, because blood cannot pass through well because of the viscosity of the blood. If there's a lot of sugar in it, it takes time. Though, however, if this occurs, teiketo shoujo. Te means low blood sugar level. So that is hypoglycemia. So if ever blood sugar level really goes down, then you'll develop hypoglycemia. The body will go into shock, and that can cause death. This is something we need to also watch out for. So the remedy for this is just if the person is exhibiting shock from hypoglycemia, so just give sugar or candy, any candy. So we're now done with number 4. We'll now go to number 5. Number 5 is Parkinson. Parkinson disease. So there are 4 shoujo, signs and symptoms. First, we have Shinsen. So Shinsen or tremors. So tremors, shaking. This happens during ansei toki. So when this happens when it's ansei toki. Ansei, when it's just like free time, or I don't know how to say that, when you're not doing anything. Yeah, so even if you're not doing anything, tremors happen. Shinsen. So next, Kinkyogo. Kinkyo. What does this mean? Kinkyogo. Kiniku ga kataku naru. Kiniku is muscles, right? Kataku naru hardens or stiffens. Kiniku ga kataku naru. What's the kanji for that? Kataku naru. And it's also called kinshuku or kinshuku. So if ever in exam they're gonna be using another term instead of kinkyogo, so that's gonna be this term, kinshuku. Okay. Contractures. And the third one, mudo matawa kado. Mudo matawa kado. So amari ogokinai, so you can barely move, or you can just slowly slow action. So if ever you know someone with Parkinson's, they really move slowly, right? Especially if the disease progress, even the esophagus muscles is not moving properly anymore, so it's prone to choking. It's a choking hazard for advanced Parkinson's diseases. So if I may write here, this mudo or kado freeze movement, there's actually 3 types. I'm just going to erase 4th for now. So we have, I don't have the kanji, gamenyo, kanho, kokizami, huko, and sukumi as ashi. So for this gaminyo kanho, I think ambivalent facial expression. So they only have one facial expression because, yeah, muscles, face is also composed of muscles, so it doesn't move that freely anymore. And then, what's this? Is this sukumi? Kuzami? Ko? What's this? Hoko. It's the gait or the walking pattern. It's how do you say it? This is about walking also. So how do you say this one? Small movements, small, then gets fast without stopping. It's prone to tento, falling. And the 4th one, it's gonna be Shisei Hansha Shokai. Hansha Shokai. So blah blah blah. Shisei Hansha Shokai, balance is bad. So balancing is difficult for patients with Parkinson's disease. And let's now, so as I've said that they have also difficulty swallowing, so that's enge shogai, that's on page 51. They also experience genkaku or hallucination, yeah, cannot be seen. They see things which doesn't exist. They hear things which doesn't really exist. And constipation. Yeah. So there's really no treatment yet for Parkinson's, only palliative treatment to delay the progress of the disease, but there's really no cure yet. It's just symptom palliative, not palliative. Yeah, just delaying the symptoms. And okay, so the rest they're self-explanatory. So the rest we have Kansetsu Ryumachi, the number 9 Kotsuso Shosho osteoporosis, 10 Kosetsu fractures, 11 Zenritsu Sen Hidaisho or prostate enlargement, and 12 Myoshikin or urinary incontinence, 13 eye diseases Meno Byoki, and 14 Mimi no Byoki or ear diseases, and then 15 Kansensho or infection. So for the infection, let's be careful with our older people, because they are high risk. Their immune system is down, so if they get viruses and bacteria, it's gonna be hard for them to recover because their body is aging, right? So we have to be careful. We have to do preventive measures, hand washing. Yeah, important, hand washing. And we also wear face mask though in the unit, in the facility, for to prevent spread of infection. Okay, so there guys, I'm now done with chapter 5, and see you on chapter 6. Thank you so much for listening, and I hope you click the like button and subscribe to my channel. Good night.